Hello, I'm
Hi.
Rachna from the Dentist Channel Online. Today we have Dr. Akshay Kumarswamy with us, who is a periodontist and
Thank you.
implantologist. So, sir, I would like to ask you a few questions.
Sure.
What do you have to say on long-term success and stability of implants?
So, long-term success and stability of implants completely depends upon the soft tissue and the bone envelope that is there. We talk a lot about, this is the best implant and that is the best implant. I feel that, again, giving the analogy of a good car, if it's maintained well, then it runs a long way. So, the patients need to make sure that they maintain these implants. What does maintenance mean? Maintenance means the patient coming in every 6 months to a year to ensure that we take some x-rays, do some local prophylaxis in the area, and ensuring that everything is in the working mode. So I think all of that helps a lot in ensuring that the patient has implants as we promise them usually throughout their life. Whenever a patient comes in, we tell them that implants are guaranteed for life. Of course, you should not use the word guarantee in any treatment, but again, there are some patients who insist on asking for that. But yeah, I think one of the main things is maintenance. As with anything in life, we need to ensure that implants are maintained, and that will ensure that there's long-term stability.
Okay. And is there any memorable case you want to share with us?
So, funny enough, of course, I have a lot of cases that I did at my residency, and this one case comes to mind. So, in residency, what used to happen is whenever we did any big case, we always wanted our professor to be on the other side, the assistant side, so that he could help us. And I had scheduled a lateral window sinus lift to be done. And on that day, the professor fell sick. Now, until then, I had seen a lot of lateral window sinus lifts. I had assisted my seniors in the case. But here I was hoping that he would hold my hand and take me through it. But he, of course, couldn't turn up that day. So I took the bull by the horns and I said, you know what, I'm going to do it. I know how to do it. I had one of my junior residents come and assist me and did the case and successfully went. And I hope the implant is still there in the patient's mouth. Of course, I've lost track since this was in my residency. But I think that was one case. The other case that comes to my mind is once I moved back to India. There was this patient in our practice. And again, as I mentioned before, my father is a periodontist and we have a 43-year-old practice in Mumbai. So when we had a patient who has been treated by my dad for many years, and they came in and they said, oh, are you going to treat me? They looked at me. I said, if you don't mind, I would love to. So she said, oh, your father has always been treating me. He has this gentle hands. I hope you can do, a very similar treatment like him. I said, why don't you have a seat and let's see, we can take it up from there. So I went through the entire treatment, and after we got done, she got out of the chair and she went straight to my dad and she's like, Doc, I think you have a competitor now. I think your son is excellent and he has the similar hands like you, or maybe better. So I think that made my day and kind of upped my confidence. So two memorable cases would be those cases that come to my mind right away.
Nice. And then do you feel the need to upgrade any materials used in implants?
So materials keep coming and going, and again, a lot of materials in India that we have currently are available in the entire world as well. So we do have the best of things here in India. Of course, there are some regulatory issues here and then where some materials are out of supply and they come back into supply. But I think there are a lot of good materials and devices that are available here. The main thing is one should know how to use it. Now, unfortunately, what happens is a lot of these materials and devices are being marketed by the company directly, and many of them through the medical representatives. The best way to do it would be by observing a senior practitioner or somebody who's been using that device or material and see how they use it and then put it into practice in your own setup. Yes. So I think that is something that needs to improve. I've again heard horror stories about how some dentists who want to place implants in their practice call in people from the company, and they come in directly. The medical rep comes in and says, you know what, I'll place the implant for you. I mean, that's a little scary. So that is something that I would not advise. I would advise all the young dentists and those aspiring implantologists to learn things the right way. I mean, attend conferences like these, again, attend online courses that Dentist Channel Online has, and learn things the right way, observe, mentor. Again, I mentioned previously as well, having a good mentor is always helpful. So just go into a senior practitioner's clinic, ask them if you can observe, and that adds a lot into your practice and how you do things later on in life as well.
Okay, nice. And could you tell us why the new practitioners should not lose hope in dentistry?
So I do see a lot of this about, there's a lot of competition in dentistry. There are so many dentists coming out. I remember what my mother always says. She says there's always light under the sun. There is light for everybody. The sun gives light to everybody in the same intensity. So there is always place under the sun for everyone, and we need to make sure that we set our mark. One thing that I would like to tell young dentists is patience is a virtue that they need to have. Previously, during the previous generation, whenever dentists opened their clinics, they would wait about 3 years before they could start seeing profits. Now that timeline has increased, of course, with the population increase. Now they say that you need to wait about 5 to 6 years. Okay. A lot of them start losing patience much before that. A lot of them, kind of in despair, go into other realms of professions. Again, it also depends on what that person is bringing in, because a lot of them are first generation dentists, and they have the pressure of running the family. So I would not completely blame them in terms of trying to find other professions where they will get instant funds to help their families. But for someone who can be in there for at least about 5 to 6 years, I am sure that the practice will take off. Of course, they also have to ensure that they are opening a practice in an area where there is need. A lot of them would want to be closer to their homes, and understandably so. But again, a little bit of a travel will not matter if you can get into an area where there is not many dentists around. Again, India is in need of dentists in the tier 2 and tier 3 cities. So I think especially now I hear that tier 2 cities are doing amazingly well in dentistry. Yes. So that is something that I would advise people to look into those, move out of your comfort zone. I know that you would want to stay close. I mean, for me, being in the US, I wanted to come back. So that itself was a big decision, ruffled a lot of feathers. People still ask me, like, are you sure you'd made the right decision? So I think that is something that I would ask all young dentists, that, make sure that you get back into your comfort zone, but sometimes you also need to move out of your comfort zone. So it has to be a balance between the two. But yeah, losing hope is not something that I would advise any of you to do. Make sure that you have some patience, and that patience will reap rewards.
Thank you so much, Doctor. We're so happy that you were here with us today.
My pleasure. Thanks.